let's talk aphasia and depression. Welcome to Converse with Julie F. Why do I want to talk about aphasia and depression? Research shows the incidence of depression in aphasia is anywhere from 62 to 70%. That's a lot. How are you feeling? Are you feeling a little down? No, this isn't my emotions video. But aphasia and depression, it's real. And I want you to know about it, and I want you to monitor yourself because I don't want you feeling alone and depressed. So unfortunately, I don't have all the answers, especially because I'm a speech pathologist, I'm not a psychologist. But I do want you to be aware that aphasia and depression can co-occur and to keep your eye out for it and to refer yourself to your doctor, to a therapist if needed. Maybe you need a referral from your doctor, I don't know, and make sure you take care of it. One of the biggest reasons why people with aphasia get depression, well, I don't know if I can say that, but one of the causes of depression in aphasia is because you're socially isolated because of that difficulty communicating. And I really don't want you to socially isolate yourself even more because of the aphasia. I want you to keep an eye out and try reaching out to your family members, seeing if you can keep yourself in that family circle or friend circle, whatever. I have a big family circle, to help you keep connected with other people and not sink into depression. Obviously there's a lot more than that, and I want you to talk to your doctor if you're worried about it, talk to your therapist if you're worried about it. I just want you to keep your eye out for those symptoms. You can look up depression scales, because it's not really my scope of practice to discuss depression, but some of the things that can mean you're depressed are lack of interest in doing things, sleeping more, sleeping less, weight gain, weight loss, isolating yourself, keeping yourself away from things that you enjoy, not finding joy in what you used to enjoy. And I want you to really keep your eye out for any of these symptoms so that you can get help. And I was looking at what we can do for aphasia and depression because, I don't know, right? It's not my scope of practice, but I like to do something with people and I think it can help. I found some resources saying it was good for people with aphasia because it doesn't involve talking, and one of them is meditation. Have you seen any of the meditation apps that are available? Or even just turning on music from YouTube and just sitting there and breathing deep. I highly recommend looking into meditation as a way to help keep that depression at bay, as well as talking to your doctor and going to a psychologist, because those are really the biggest things I would recommend. Another thing that I saw that could help is being around animals. It might not be possible to have a pet right now because of everything you're going through. It might be too difficult to take care of them, or maybe you moved into a facility where you can't keep a pet. But maybe you could go to a dog park and just even sit outside of the area and watch the dogs. See if right now it's a little more complicated because of COVID, but if you can sit on a bench and watch dogs play, that usually raises my mood a little bit. And I love dogs a lot, not the barking ones you can hear in my videos, but I do love dogs a lot. And you could see maybe if there's therapy animals that you might be able to go see. There's even little mini horses that are therapy animals and you can pet them. And one of the nice things about animals is that it can help you communicate as well. I do plan on making a video about communicating with animals because I love animals, but it can help you communicate better because there's no pressure, just like my video. I hope no pressure on anyone responding back to you. You can just kind of talk to them. Aren't you a good little puppy? So meditation, being around animals if you like animals, and talking to your doctor. And to be honest, I actually just put on this top for this video because trying on fun things makes me happy and kind of helps me lift up out of sadness. And I know depression and sadness are different, but when I'm in a really big funk, I do something that I know will make me happy, and trying on fun things that I don't get a chance to wear right now because I'm stuck in my house makes me a little happier. How do you feel? Tell me how you feel. Do you think you're going to talk to your doctor after this? If you're feeling a little depressed, reach out, get some help? I hope so. Because, like I said, the incidence of depression with aphasia is very high. And I don't want you to suffer with it, because life is worth living. Life is good most of the time. It gets better. But sometimes you can only get better, a lot of the times you can only get better with professional help. So I hope that this encourages you to monitor those symptoms, reach out if you need it, because people with aphasia suffer from depression at high levels, and I want you to be able to live your life the best you can post-stroke with aphasia. All right, if you see my face pop up, please hit my face. Oh, that sounds weird. And subscribe, and let me know in a comment how you're feeling today. And I hope you're feeling great, or I hope you're feeling motivated to contact your doctor so that you can start getting better if you feel that this is something that's going on for you. See you next time.